Week 16. Your baby is now about 4.5 inches long. It's somewhere between 3 and 5 ounces, and of course continues to grow and grow. Week 16 is the time when we start doing the second trimester screening, or what's traditionally called the AFP. Now again, not everybody is going to want to do the AFP or the second trimester screening because the blood test has a very high false positive rate. Honestly, most of the abnormal blood tests, the baby's normal. If it comes back abnormal, the next step is do an amniocentesis. That's where you put a needle in the mom's tummy and get fluid from around the baby. That can tell for sure if there's a problem, but has a small chance of causing a miscarriage. So because of that, some people prefer not to do this testing. But if you're going to do it, this is when typically we do that second trimester screening. This is also when it's possible to do amniocentesis safely. And again, that's the test with the needle in the tummy to get fluid from around the baby. We'll tell you certain things about the genetic characteristics of the baby with a very small chance of miscarriage, about 1 in 200. This is offered to women of what we call advanced maternal age, which means over 35 or 35 and over. And the reason is that the risk of having a genetic abnormality in a woman that's 35 or that's age 35 is 1 out of 190. Very, very small, much less than 1%. But it's the first time where that age-related risk is actually higher than the risk of the test itself. So at 35, you're not particularly old or particularly have a high risk of a problem. It's just a mathematical function that that's the first time when the statistics say that the baby has a higher chance of a problem than the chance of causing a problem from the test. So this is 16 weeks when we can do the amniocentesis if that's something that you want or are a candidate for. Also at 16 weeks, the baby is now able to perceive light. And you do see some eye movements at 16 weeks. So the eye functioning is starting to come along, and there is some perception of light. So 16 weeks, about 4.5 inches, about 3 to 5 ounces. And this is the time when you have to think about that genetic screening.
Medtwise.com